Mpox. The World Health Organization has declared a global public health emergency on Mpox. Mpox. They raised the alarm on Mpox after more people in Africa got infected with the disease. Based on the latest data, over 17,000 of Mpox cases were recorded in Africa so far. Over 500 patients have succumbed to Mpox. Mpox patients experience fever, skin rash, body ache, weakness, and swelling of lymph nodes. There are currently no vaccines or treatment for Mpox, but infected people can naturally recover from the disease. The health department assured the public that we are still Mpox free. The country has recorded 7 cases of Mpox in December 2023, and all of them have already recovered.
Ang lagi namin sinasabi sa public health, kailangan po alerto tayo. No? Yung parang kanina, tamang praning lang, wag masyado. Bakit? Kasi kailangan alam rin natin kung anong gagawin natin para hindi tayo mahawaan, para tayo ay makaingat.
To talk more about this, we have infectious disease expert Dr. Lulu Bravo.
Good morning, Doc.
Hello, good morning, Angelo and Angela. Wow. Thank you for having me here.
Thanks for joining us today. Siyempre po, we want to get your thoughts about the declaration of a global health emergency regarding po Mpox.
Yes, I think that is because they want to be aware. WHO wants to be ready then.
Yes.
To learn from the lessons of COVID, diba? It is important now for every country, dapat lahat ng bansa ay nagiging preparado na.
Yeah.
So, even with just Africa pa lang, we cannot just say na dyan na lang sa Africa yan.
Yeah.
Because with migration, with travel, di ba? Lahat ng mga tao ay posibleng makapagdala ng monkeypox. Actually, yung sa Pilipinas, yung kinikwento nila kanina, galing din yan isa sa ibang bansa. Tapos pumapasok sa'yo na hindi mo alam, hindi ka prepared. So I think this is an important issue for every country to be prepared, to be aware, to be vigilant. Dahil may symptoms naman yung monkeypox ng rash. Parang ano nga yan yung bulutong tubig, chicken pox.
Yeah,
you know,
it's
similar to that, yung rash. So if there is someone doon sa katabi mo, sa airport, or doon sa aeroplano na nakikita na merong rash, makikita naman yan sa mukha, sa kamay, di ba? Vigilant na sila na examinin muna bago papasukin. Nung sa ganon, hindi maging kalat yung sakit. Dahil nag-umpisa kasi ang pagbabantay natin. That's why the global health emergency is being announced so that countries will be prepared at huwag na tayong magpabaya.
Yeah, Doc, you mentioned the word vigilance. You also mentioned the word travel. Now, at this point, should all governments or even our government start to discuss, not even implement yet, but at least talk about imposing a possible travel ban on certain countries with Mpox cases? And karugtong po ng question ko na yan, Doc, is ano po ugali ng Mpox? Kasi ang COVID, may mga asymptomatic cases, so mabilis makapanghawa. Ang Mpox po, pwedeng carrier ka na at wala ka pang symptoms, kaya makakalusot ka ng borders?
Well, ganito yan. Ang Mpox, mabilis mong makita dahil dun sa rash. Sabi ko nga, parang bulutong tubig. Mahirap naman sa akin, sa palagay ko lang, mahirap namang mag-ban kaagad ng countries na papuntahan kung importante sa atin economically na makipag-negotiate or makipag-connect with other countries. Parang masyadong overkill naman. But from port to port, ibig sabihin, kung meron tayong vigilance, maski sa airport or sa mga travel from countries, ang importante yung ating alert system.
Yes.
Alam mo, maganda naman ang alert system ng Department of Health. Hindi ka kailangan mag-ban muna. Kasi yung importante lang is meron tayong alert system na, yun, di ba, yung ating e-travel na tinatanong naman kung ikaw ba ay may sakit, ikaw ba ay gano'n. And then meron maganda yung naging experience naman natin nung sa anong tawag yung sa avian flu noon,
Yes,
yung Middle East, maganda. Hindi naman nagpapabaya rin ang ating government. Pero kaya nagsasabi ang WHO. The reason why WHO declares global health emergency is really for countries to be prepared. But
Right.
doesn't mean you will close your border. I don't think so. We really need people to be just aware. If you are in an airport, in an airplane,
Doc,
it's easy to identify brush.
right. Doc,
Yes.
kasi po, most people, however, have abandoned yung mga basic protocols natin since nag-lift na nga po ng COVID-19 restriction. So, what else can the Department of Health do para po ma-disseminate yung information and mas magkaroon po ng impormasyon, knowledge yung mga kababayan po natin regarding Mpox?
Well, one thing is awareness. And the Department of Health has always naman been trying, in fact, every day, we hear news from DOH to be aware. Even you, the media, is doing your
Right.
best to make people be informed so that we can be aware. But make sure that they come from reliable sources, right? We should not be making panic naman. Don't make the people panic. There is no report of monkeypox yet in the Philippines, unlike that of 2023, and that was also contained.
Yeah.
And the Department of Health is doing their best to raise this information and always to get the media also, and also the doctors are already telling their colleagues sa atin sa private sector. The medical societies are also doing their best to discuss about monkeypox, so that people are aware. Alam mo, one of the important areas to look into is our mag-Google kayo, diba? We are really informed from reliable sources. And I was just looking over a very good article from Cleveland Clinic. You know what? My daughter is from Cleveland, and I was reminded that the first monkeypox reported in Cleveland was done by my daughter. She's an adult physician there. And they really appreciated that for every doctor to really look and see. Pag she or he gets to recognize one case, dapat reportable na yon.
Yes.
So that we can become vigilant. So doctors are also mandated to report something like that. So Department of Health must warn our doctors to also be vigilant, hindi lang public. The doctors, if you see something like pock marks or yung parang chicken pox, diba? They should already make the test, or although the tests are not very common. In fact, I think only reference laboratories are going to do the test for monkeypox. Maybe the research institute, not all laboratories. So it is very important for our doctors to recognize the presence of a unusual lesion or unusual rash that looks like a chicken pox.
Okay. Alright, on that note, maraming salamat po sa inyong oras. That was Doc Lulu Bravo, an infectious disease expert. Thank you po.
Thank you very much, Angela.
Thank you.
Ayun. So
Yun.
no reason to panic, but
Yes.
just to be vigilant.
Vigilant,
And you have to understand what Mpox is like, para that way hindi tayo nagpapanik. Ang COVID kasi when it came in,
Nagpanik tayo, wala tayong alam.
Wala tayong alam about it. Ito, intindihin natin ang Mpox, diba? I mean, may chickenpox, may Mpox, may smallpox. Learn how to differentiate among the three.
Totoo. We have the leverage to be, para makapag-ingat tayo.
Tsaka
diba?
your body,
ma-inform yung ating mga kababayan regarding
your body daw recovers naman in its own time.
Yes.
But it's up to you to find out kung meron ka certain comorbidities that will affect your recovery, then you can go to the doctor.
Yes.
Or are you vaccinated for chickenpox? May
Totoo.
effect ba to sa Mpox? Ask your physician right
Oo.
now.
Ang magiging challenge lang or nagiging challenge daw ngayon according sa WHO ay yung different modes of transmission.
Yes.
Unlike daw before nung 2022, parang ang nakikita lang nila before yung through sexual contact . Diba?
Parang mas bago ata ang
Ngayon
sexual.
marami, oo.
Hindi, nung una ata was
No,
human
noong July
contact.
2022,
Sexual contact was newer ata.
Detected was through sexual contract. So ngayon daw, there are different modes of transmission. Meron din from animals,
Oh.
pwede rin na, ang tawag dito, kissing, pwede rin yung kung may mahawakan ka, mga ganon.
So kahit hindi monkey, pwede ka. Kunyari, may pinat kang dog.
Do you
No,
really want to ask that question? Oo.
Yes. Isn't it a relevant question?
Pero yung nga sinasabi nga nila, yung symptoms can take 3 to 21 days to develop. Pero
Carrier
kung
ka na.
ikaw ay infected na, carrier, pwede ka nang makapanghawa.
At saka ano ha, sinabi to when we talk to, I forget who we talk to, at the end stages daw of this Mpox disease, when you're healing, that's when you are most infectious also. Di ba? Kasi yung virus, I think the virus or bacteria tends to leave the host looking for a new host eh. Anyway, ayun, that was Doc Lulu Bravo and it was nice to talk about that para maintindihan natin